We we were discussing tinnitus. We wanted somebody to speak on tinnitus, and Richard Tylor came up because, and I'm about to tell you why. Um, Dr. Richard Tylor, I should say. I'm going to tell you a little bit about his background. He received a Bachelor of Science of Communication Disorders and Master's in Science and Audiology at the University of Western Ontario, and PhD in psychoacoustics from the University of Iowa, and is currently professor of otolaryngology and in communication sciences and disorders in the University of Iowa. Dr. Tylor has been a visiting scholar in China, South Africa, Australia, Sweden, Poland, Germany, and France. His main areas of interest include tinnitus, hyperacoustics, and cochlear implants. He has edited several books, cochlear implants and ideological foundations, and on tinnitus, a tinnitus handbook, tinnitus treatments, and a consumer handbook of tinnitus. He is serving grant review committees for the NIH and VA and the DoD and others, as well as on committees for the National Science Foundation and the World Health Organization, Department of Defense, and American Academy of Otolaryngology, and the Veterans Administration. He sees tinnitus patients. Here's what I think is really cool. He sees tinnitus patients weekly and hosts an annual tinnitus and hyperacoustics treatment workshop every June. So, Doctor, I'm very pleased to welcome you and look forward to hearing what you have to say.
Great, thank you very much. It's a pleasure to be here. So I need to share my screen, I believe. Is that right?
Go right ahead if you want to start into your slides.
Share screen. Is that working?
Yes.
Okay, let me just move that over here. Well, I guess I'm not sure how to do that easily. Okay, so so here we go. So the focus here is on helping our tinnitus patients, and I'm very glad that you're interested in doing this. It's a wonderful thing for you to be involved in, and a lot of our patients that we see with hearing loss are under great stress with their tinnitus. So being able to help them with that is another important thing that you can do in general. So why is this person screaming? Well, you're all wrong, sorry, but I will provide more information later on about that. So we're going to focus today on tinnitus activities treatment, something we've developed over the years and modified several times, and provide an overview of what actually is included in that. And it's a way to connect with your patients, to provide sound therapy and counseling and hearing aids, and to make the patient feel like you are knowledgeable and helpful as a clinician in general. So it's an important first step. So the 4 different areas that are affected by tinnitus patients, different in different patients, so they're not always all affected by 4: thoughts and emotions, hearing, sleep, and concentration. And I refer to that as my psychological model. You have your tinnitus and you have your reactions to the tinnitus. So those are the 4 different reactions that you can have. We can use the Tinnitus Primary Functions Questionnaire, which is available for free online at our university website, to help guide you and the patient of what areas need to be affected and which ones don't. We usually focus on a preliminary counseling session, which I will show you, just to connect with the patient, find out what things are bothering them, and then focus on one session per area, depending upon their needs in those 4 different areas. And in between the meetings, they have homework activities. They can practice some of those in the clinic before they go. And when they come back for the next visit, usually a couple weeks later, we can go over their homework and see how they're doing. So that's a general overview of the direction. So tinnitus activities treatment. So this is what we do for those first patients. Okay, when they first come in, they complain about their tinnitus, and we're going to meet with them for the first time. So where do you want to start? I want to know where they're at. I want to be a good listener. I want to understand their individual needs and their expectations. So just to get them started, what do you think caused your tinnitus? So the most common causes, of course, are noise and the aging process, but sometimes it's simply unknown. But I'm going to be a good listener here. When your tinnitus began, what was your life like? So we're all different. We all have challenges. We all have ups and downs. And I want to be able to connect with the individual patient and see where they're at, what their life is like. How has tinnitus influenced your life? So again, let the patient explain where they're at. How do you think we might be able to help? So I don't have a magic pill either. So why are they here? Why do they think that we can help them? How do they think we can help them? So I want to listen to them, and I want to understand what their expectations are. How would you describe yourself? Are you curious? Are you concerned? Are you distressed about your tinnitus? Where are you at? How are you dealing with this? So everybody's different, and tinnitus affects patients differently in different ways. Thoughts and emotions, hearing, sleep, and communication. So a lot of patients tell me they have sleep problems, but not everybody, for example. So I want to understand where you're at. So for thoughts and emotions, it's reasonable that when you have hearing difficulties and you have tinnitus, that's going to get in the way of your thinking and get upset. You have to pay attention. You can't focus on that. That's going to create emotional challenges. And your tinnitus can affect that. So we want to focus on thoughts and emotions so we can help you change your reactions to your tinnitus. Hearing and communication is another area that tinnitus can affect. So, you're hearing this sound, and that can mask or distract you from listening. And so it's important to understand hearing and communication and some ways that you can improve your hearing ability. Sleep. We'll go over normal sleep patterns. It's quite reasonable that tinnitus can affect your sleep. We're going to suggest some activities that can facilitate sleep and what to do when you wake up in the middle of the night and you're in this dark room and all you hear is that ringing sound. The fourth potential area that you could be affected is concentration. So lots of things can affect our concentration, including tinnitus, and we'll go over some strategies to improve your concentration. So in your sessions, we will include only the sessions that are relevant for you. We'll go over our presentations and discuss these with you, answer any questions you have. We'll actually practice some of these activities in our clinic before you go home, and then you'll be assigned some homework. And we'll see you in a week or two, depending upon your schedule, go over your homework and go into the next session. So that's the end of the session. So again, I'm going through this fairly quickly to give you a broad idea, but the idea is when the patient's coming in for their hearing or their hearing loss or their tinnitus, just connect with them and tell them that you provide some services to help with their tinnitus as well. And that's those slides so far as an introduction to the patient. to show them what is offered in your clinic. So most of the patients have challenges, and so I'm going to go through all 4 of the different areas. And the first one is thoughts and emotions. So today we're going to talk about your hearing and hearing loss. We're going to talk about your tinnitus and the attention it can cause, including changing your behaviors and emotions you might have. We're going to help you learn how to change your reactions, and then you'll get some homework to go home with that we can practice first in the clinic. So first of all, hearing and hearing loss. So this is, of course, how we hear. So you have some sound goes through your ear canal, your eardrum. Behind your eardrum is air-filled cavity. And then you have the cochlea that has hearing nerves. And that sends information up to your brain. That's basically how we hear. So in your cochlea, and again, just keep in mind, I'm going through this rather quickly for you, but you can go through more slowly with your patients. Inside the cochlea, you have these hair cells, and that creates what we call action potentials, little nervous electrical signals that are carried from the nerve, carried by the nerve fiber, going all the way up to the brain. And you've got thousands of these hair cells and nerve fibers, and that's what carries the information up to the brain to let the brain know what you're hearing. So it turns out that even when there's no sound at all, there is spontaneous activity on these nerve fibers. But your brain has learned to ignore that, so your brain doesn't hear that spontaneous activity. So you get no sound, quiet, you hear silence. Somebody says the word table, and that activates lots of different nerve fibers, and your brain hears the word table. Or it could be a sound of a cricket outside, and that creates different activity on your nerve fibers, and your brain interprets that as a cricket sound. We'll come back to that. Lots of different causes of hearing loss. Some of them are unknown. The most common ones, of course, are noise exposure and aging. We're all losing our hearing as a function of our age. So going back to those nerve fibers, in normal hearing, you have thousands of these nerve fibers, so there's lots of information sent up to the brain. When you have a hearing loss, you actually lose some of those hair cells and lose some of those nerve fibers, less information sent to your brain. Well, we cannot replace hair cells, so how we help people with hearing loss is provides hearing aids. And hearing aids are a wonderful thing, actually. They make sounds louder for you. They make things easier to understand. They don't restore your hearing to normal, but they can certainly help you understand and communicate. So that's a wonderful thing. So let's have a look at your audiogram. So the patient brings in their audiogram with them, and we have it perhaps already, and share that with them. Okay, so these are the sounds that you can hear and you don't hear. Do you think you have a significant hearing loss? What difficulties does your hearing loss create? What have you done to improve your hearing? Okay, so now we're going to talk about the tinnitus. So it's a sound in your ear or your heads. It's different for different people, ringing, buzzing, hissing. What is your sound like? Well, tinnitus is linked to your hearing system and is a function of damage, and it's usually associated with some sort of hearing loss. The tinnitus itself will not damage your hearing, but your hearing may continue to decrease, but not due to your tinnitus, just because it's part of the natural aging process or natural deterioration following noise, for example. So many different causes of tinnitus. What do you think caused your tinnitus? And again, you're connecting with the patient, letting them speak, you're interacting with them. It turns out that tinnitus is very common. About 15% of the population actually has tinnitus. So you have friends that have tinnitus, but you don't know it because it's invisible. About 1% of the population is very troubled by it. And actually 30% of the population over the age of 60 has tinnitus. So you'd be surprised, perhaps, how common this actually is. At this point, there is no drug or surgery that can reliably eliminate the source of the tinnitus. However, you can change your reactions and how it affects you. And of course, we're here to help you with that. So back to the brain. The brain's pretty complicated. This is your forehead over here on the left-hand side. And there's an area on the side of your brain called the temporal lobe, and that's where the brain receives information from your ear called the auditory cortex. So when the brain receives activity from your auditory cortex, that activity is transmitted electrically, those nerve fibers activating the temporal lobe. So in normal hearing, there is actually, as I mentioned, spontaneous activity, and your brain interprets that as being quiet. When you have a hearing loss, you lose some nerve fibers. You might lose some activity on some nerve fibers, and your brain hears silence. It's missing out on something. When you have tinnitus, there's some activity on some of the nerve fibers, and your brain is doing what it's supposed to do. Your brain is interpreting that activity as a sound. Your brain's doing what it's supposed to do. So tell me again what your tinnitus sounds like. So if it's a whistle sound, it's going to be repetitive activity on your nerve fiber. It's a cricket sound, or it could be something else. So the idea here is to help the patient understand they're not making this up. It's not something terrible. It's just something, activity going on in their brain. So now I want to talk about attention. So there are different types of attention. Some things naturally capture our attention. And it turns out that our own emotional state has an influence on what does or does not capture our attention. So many things are going on. We can touch things, we can smell things, taste things, see things, and hear things. And those are all going on at the same time. We usually focus on one or the other, but we can directly smell things and sort of ignore the other things sometimes, for example. So when we consciously focus on touch in this example, and maybe you can touch the keyboard in front of you for a minute. When you're doing that, you're not focused on other things going on, like vision or hearing or smell. You're focusing on one thing, not other things. Well, if the police car drives by outside our window, that's going to grab our attention. So that's consciously what's going on. Now, even when the police car is driving by, there's still this things going on in the background that is activating our brain subconsciously, but we're focused, our conscious attention is on the police car. So things that capture our attention, in addition to the police car, are unusual things going on, scary things going on, or unexpected things going on. They can even be pleasant, like a birthday cake. But things can capture our attention. We can actually decide what to pay attention to. So for the police car, if it's driving by outside, there's nothing wrong with in your home. Okay, so it's gone by, I can still hear it, but it's not important. We can actually also do something else. We can keep ourselves active. Working on a project or thinking about something or just doing something else, and that helps us focus on our attention on something else going on. If we're uncertain about what's happening in our life and what's the siren, what's that sound, then if it's important, we're going to continue to focus back and forth on it, and it won't escape our attention. So that's important to keep in mind. So tinnitus itself does not make you deaf. It does not lead to senility, and it's not a sign of mental illness. It's a sound that's going on in your brain. And of course, it's quite reasonable that when you're worried about your tinnitus, you're going to focus on it. You're going to focus your attention on it and be preoccupied by it. So that's pretty reasonable and pretty normal, particularly when the tinnitus first starts. Usually those first weeks, the first few months are the worst, patients tell me. Not supposed to be there, they're hearing a sound, what's going on here? So those initial reactions are quite reasonable. So we're going to do some activities now. I would like you to describe an image that you like. So you can close your eyes now and tell me about an image that you like. Might be a new car that you're thinking of buying. So now tell me about an image that you don't like. And when I close my eyes, I think of a snake. I don't like snakes. What about a sound? Describe a sound that you like. Maybe classical music. What about a sound that you don't like? When that siren goes by. Now describe your tinnitus. It's a sound. Again, it's not a good sound or a bad sound, it's just a sound. Okay, so now we'll focus on maybe the most important thing here is how to change your emotional reactions to your tinnitus. So we have to understand that there is a connection between how we think about things and our reactions to them. So if we have neutral thoughts about things, then the reactions are neutral. If we think something's terrible, we'll have a negative reaction. But if our thought process is looking forward to something, is interpreting something as being good, that could have a positive output. So we have to separate the thoughts from our emotions. Those are two separate things, thoughts and the emotional consequences about our thoughts. So a good example here is the doorbell goes off. Well, no big deal, just a doorbell. 2 weeks later, the doorbell goes off and there's a fire outside your house. Oh no. The next day, the doorbell goes off and there's been a car accident outside your front door. The next day, the doorbell goes off and your tree has fallen over on the neighbor's lot. So that doorbell sound is creating anxiety for you the next time. A month goes by, the doorbell rings, someone delivers flowers to you. The next day, the doorbell rings and a friend arrives to see you. The next day, the doorbell rings, it's a delivery person sending you a gift. You're happy. So it's all the same sound, it's a doorbell, but your expectations and your experience with that sound has a direct impact on your emotional reaction to the sound. So you have to keep in mind the sound and the reactions to the sound. Those are two separate things. So tell me what your thoughts about that you have about your tinnitus. Are there some situations where your tinnitus is really, really bothersome, sometimes during the day? What do you think about your tinnitus? What do you think caused it? What kind of fears do you have? I want to listen to hear you talk about your tinnitus and how it's affected you. We're all different, but it's reasonable to be upset when that first starts. So how can you change your reactions to the tinnitus? And this is true for all of us when something bad happens or distracting happens in our life. So these are some ways that we think that we might be able to help you changing your reactions to your tinnitus. You can change the interpretation of how important this is. You can change your emotional reaction to the sound. A third way is to refocus on other activities. Keep yourself busy. And a fourth way is to reduce the contrast between the background sound in the room where you are, might be quiet right now, and your tinnitus. So we'll talk about each of those. First of all, changing the importance. So as we noted, tinnitus is a result of increased spontaneous activity on your hearing nerve. So one of your nerves is hyperactive. That's what the tinnitus is. Many people have tinnitus. You're not alone. As I said, you probably have friends that has this. You just don't know it. It's invisible. Thirdly, the tinnitus is not threatening your life or your hearing. It's a sound, but it's not affecting your breathing or your heart, or not even affecting your hearing directly. But we'll go into that in more detail. And we need to make it clear that you have your tinnitus and you have your reactions. And those are two different things. And we're here to help you change your reactions. So you have tinnitus, negative reaction, negative thoughts. You have tinnitus and you're anxious and irritated, and it's going to be even worse. But when you have your tinnitus and you're less irritated by it, you can come up with some constructive thoughts in your life. Then you're going to move on, and you hear a sound. Okay, you've got that tinnitus. Okay, it's just a sound. It's not a good sound or a bad sound. It's a sound. The tinnitus becomes less prominent in your life. And I'm not suggesting there's an easy fix here. Everybody's different. But these are some things that we've learned from patients and that patients have done. And we hope we can help you in this direction. So let's talk about some things that you can do. Tell me about the hobbies you have. So somebody might say, well, they play tennis or whatever, and the pictures here are gardening and golf, for example. So tell me about the hobbies. What do you do when you're having fun? When you're doing these things, do you still hear your tinnitus? Are there some things you can do that help you ignore your tinnitus? What about new activities? We all like to enjoy life and try different things and move in different directions. So having new activities might be a good thing, might make your tinnitus less prominent. Good for all of us. Now I want to focus on the contrast between your tinnitus and background sounds. So for a lot of people, having some background sound can actually help. So the top figure there shows actually low-level noise. So if you hear shh, that noise, your hearing nerves are spontaneously randomly activated, low noise level in the background. And right now, you might actually hear some noise in the background if you just be quiet for a second and listen to the background in your room. There's probably some low-level noise going on, and it's activating your hearing nerves. When you have your tinnitus, and here we have a tonal tinnitus that sounds like repetitive activity on your nerve fiber, and you hear a tone, that stands out. But it turns out that if you play a low-level noise over your tinnitus, then that periodic activity doesn't stand out. And that's really helpful to your brain to learn to ignore this. If your tinnitus is not so prominent, if there's some background sound that's covering it up or partially covering it up, then your tinnitus is not prominent like it is in quiet. So another example of this is you turn on a candle in a dark room. The candle sticks right out. But if you have the same candle and you have light on it, you open it up, put the candle in the window, then the candle is not so prominent. And it turns out the same thing is true for tinnitus. Tinnitus in a quiet room can be loud, but if there's some background sound going on, your tinnitus is not so prominent. Another example of this is a dog. You don't like dogs. I grew up with a cat. There's this dog barking in the room. Oh no. So you turn a fan on and you get to work. And although the dog is still there barking, the fan's on, you're working, you're focused on something else, and eventually both the fan and the dog fade away into the background. So that's part of the goal here. So there's lots of different ways to add background sound that can even help with your tinnitus. So smartphone apps, CDs, nature sounds, playing music. Some people actually play music, and when they're active, they don't hear their tinnitus so much. So background sound, there's lots of ways, different options for helping people with tinnitus. So tell me, are there sounds that you've tried that make your tinnitus less noticeable? And we're going to play some of these here in the clinic for you. So we have sounds to demonstrate to patients when they come in. It doesn't have to be loud. It doesn't have to sound like they're tinnitus. There's different strategies available on smartphones, you can have some available in your clinic on your computer to show the patients that these sounds can be controlled and level. You can try different sounds. Which sound is most effective at making your tinnitus less noticeable? Which sound is easier for you to ignore when you're doing things? So lots of good options here. Okay, here's the activities we'd like you to focus on. So you're going to go home and practice focusing your attention on your tinnitus. Listen to your tinnitus. Now listen to something else. We want you to identify some different activities that you do, make a list of these, and see how they can make your tinnitus less prominent. When you're doing some fun things, you're not thinking about your tinnitus. And then we want you to try different low-level sounds. So let's try some sounds in the background, and they can be low levels, but when you're busy and when there's a background sound going on, your tinnitus is not so prominent. So here's a diary. I'm going to give you a diary to go home. Write down your thoughts and worries about tinnitus. We're going to meet again in 2 weeks. Some examples are my tinnitus gets worse over time. Check to see if these thoughts match what actually happens. So some days your tinnitus is worse, but some days it's pretty constant. It's about the same. List alternative ways of thinking about your tinnitus that you find helpful. Well, patient wrote, I have tinnitus, but it's really a small part of my life. And when you come back in 2 weeks, we're going to discuss the thoughts you had and go over this during your next visit. List the things that reduce your tinnitus. Make a list of things that worsen your tinnitus. List some activities you enjoy. List some sounds you enjoy. List some alternative activities that you have engaged in when you find your tinnitus less bothersome, or when you find your tinnitus more bothersome. So the idea here is to give the patient something to do. They're not being overwhelmed by their tinnitus. They're trying some things, and they've got some homework to focus. So here's an example of the diary we would give them. So one activity is just going for a walk. Well, I heard these birds chirping, and I didn't notice my tinnitus when I was listening to the birds, as an example. Okay, so that's the hearing and communication section. So this is part 2 now, again. So this is how tinnitus can affect their hearing. So we have hearing. Most of these patients will, of course, have hearing loss. But in addition to their hearing loss, the tinnitus can also affect their hearing. So these are some things then It's difficult to sort out sometimes, but it's important, and these things are valuable, hopefully helpful for patients in general with hearing loss. So welcome back, and we would go over their homework and go through things. I won't do that in any detail today. Goals of treatment, we're going to talk about hearing and communication, factors that affect hearing and communication, how tinnitus might affect your hearing, and what you can do to improve your hearing. And of course, we'll give you some homework to focus on this. So our goals today are to reduce communication difficulties. And we need to find out what difficulties you have with your hearing loss and what difficulties you have with your tinnitus. And there might be some things that we can do to reduce the stress in communication. So first of all, of course, you've had your hearing tested here before. Let's have a look at your audiogram. And to start off with, I want to say that normal hearing is actually 0 dBHL from 19-year-olds done a long time ago, and it's just their pure tone threshold. So there's many ways of measuring hearing, but this is just a normal audiogram. So this, again, they're going to have their audiogram here. So this is an example of somebody with a noise-induced notch, where their hearing is worse at 4,000 hertz and then gets better at 8,000 hertz. Normal hearing is up here at the top. This is the audiogram with the noise induced. Now we're going to look at your audiogram and focus on that. Okay. So things that affect our communication: hearing loss, background noise, ability to see the talker, familiarity with the talker, familiarity with the topic of discussion, and the stress that you're under. So these are true for all of us. I know your tinnitus is the major factor here, but there are lots of things that can impact all of us when we're trying to communicate. So we talked about hearing loss already, and we may be familiar with this. You have your conductive hearing loss behind your eardrum, the little bones back there, your sensory neural hearing loss, when your hearing nerve is impacted, or mixed hearing loss, when you could have conductive and sensory neural loss, very rare. So your hearing loss is, go on to that. So this is the audiogram, and it shows the sounds that are represented in normal situations. So for example, the S and the TH and the F sounds are high frequency sounds, and because of your high frequency hearing loss, you're going to have the most difficulty with those. But lots of different sounds that different intensities, different frequency regions. So your audiogram is going to affect that, what sounds you hear, what sounds you have difficulty with. It's also true, of course, that background noise makes it difficult for most people. Noise can cover up speech. So what you can do is remove the noise if that's possible, or even move away from the noise or reposition yourself so the noise is away from the talker. A second factor is being able to see the talker. So you might not realize it, but when you're looking at the individual's face and you can see their lips moving, synchronized to the sound coming out of their mouth, that actually quite helps. There might be additional facial cues or body language when the person is moving their hands around and emphasizing something. So being able to watch the situation, the person speaking, is really important. So what situations cause you difficulty when you're hearing? Again, connecting to the patient, being a good listener. What techniques have you tried to improve your communications? What's been successful? What hasn't worked for you? So it's really important. It's important for all of us. And tinnitus can affect your hearing, as your hearing loss is going to have an effect as well, again, depending upon the individual. Tinnitus is not damaging your hearing, but it can make sounds harder to hear, and it can also be distracting. Tinnitus can also mask some sounds to make it more difficult. So there are some things that you can do to improve your hearing and communication ability. We're going to go over these one by one. The use of amplification, hearing aids, reducing background noise, being able to watch people's faces, using repair strategies, and we'll go into that, and effective communication styles. So hearing aids are really important to help us hear sounds and speech. They need to be individually adjusted to match your individual needs, but it's going to make communication easier for you. Also, hearing aids can help with the localization of sounds. That's important for safety. So have you tried hearing aids? Do you have hearing aids? What's your experience using hearing aids? Okay. Watching faces. So good lighting is important to be able to see the individual's face. And for example, if I'm covering up my mouth like that and you can't see my lips move, that's going to make it more difficult for you. So what you can do is to make sure that you can see the talker, move around if that's necessary in the room to put yourself closer, minimizing background noise, turn off a blender in the background, or get away from the visual distractions. So watching faces is important. You can also interact with the talker. I'm sorry, I didn't quite understand you. Could you slow down a bit, please, and speak a little more clearly? I have a bit of a hearing loss and this ringing in my ear. Want to make sure that you're face-to-face with them. Please don't chew gums when you're talking. It's hard. And don't put your hand, and don't shout at me. I can hear you. I just need to speak clearly. So the activities they're going to go home with then, and keeping track of what strategies you use and how they help you hear and communicate better. So that includes being able to see the talker's face, being aware of good lighting, perhaps moving around, getting hearing aids, of course, if you don't have them, that could be an important next step here, and practicing repair strategies. And you can rehearse some of these with your partners if you're going into a situation that might be difficult. So they go home with some specific activities tailored to them. They'll have some homework notes, and when they come back in 2 weeks, we'll go over that before we go on to the next slides, which includes sleep. So now we're moving on to sleep. Time in here. So for sleep, so this is the sleep session. Coming back, and again, this is one of the most common problems that people have with their tinnitus is getting to sleep. So we're going to talk about normal sleep patterns. We're going to talk about things that can affect your sleep. We'll talk about daytime activities that are influencing you when you're not having enough sleep at night, and evening activities to facilitate sleep. What you should do to prepare for sleep, what happens when you wake up at night, what to do when you wake up in the morning, and then we're going to send you home with some activities to practice. Okay, so normal sleep patterns. Well, it turns out we're all different, and typically people sleep for about 6.5 to 9 hours per night. And our sleep patterns are also different, and it turns out that it's quite common for people to wake up during the night, and sometimes referred to as light sleep or awakening sometimes. And it turns out that older adults wake up more often during the night than younger adults. So my understanding is tinnitus doesn't usually wake people up at night. But when you wake up at night and you're in a quiet room, then your tinnitus can stand out. So it's potentially a real challenge for people with tinnitus for sleep. And so it's quite reasonable that you're having problems with sleep. So lots of things affect all of our sleep, not just the tinnitus sound, but lots of things. So we're under stress, we're in some emotional challenges. There are some environmental factors, if there's background noise in the room or outside, there's a light on, the temperature changes in your bedroom can affect your sleep. True for all of us. Irregular work schedules. Some people have what's referred to as learned sleeplessness patterns, so they just get in some bad habits. And of course, jet lag and time zone changes. So lots of things can affect all of our sleep. It's quite normal to have our sleep affected on a regular basis. And when you have tinnitus, it's reasonable that your sleep is affected too. More often, physical conditions. So some people have problems with their leg or their arms, sleep apnea. Some people are taking medications, of course, coffee, tea, chocolate, things that have caffeine in them, nicotine, smoking, and excessive alcohol. All these things can contribute to sleep. So you need to be aware of that, and it may very well be that you need to and can modify some of these things in your life in general that can help you with your sleep for tinnitus. So it may not be only your tinnitus that's affecting your sleep. There may be other factors as well, things that you can do to take better control. Avoid napping. Don't modify your behavior after a poor night of sleep. Try and stay in the same routine. Sometimes people exercise in the early evening, not before they're going to sleep, but on a regular basis, and that can put your body in a way that it needs to rest. It's looking forward to resting. And even if you're tired during the day, one recommendation is to just continue on, keep the same hours that you did yesterday, just move forward, even if you're tired, make the best of it and get to sleep at the same time. In that routine pattern is good for your sleep, good for your brain. Evening activities to facilitate sleep. So this means creating a curfew at night where you slow down. Recommendation is an hour and a half before bedtime. And at that time, you avoid things like getting involved in something that would cause stress, to avoid exercise, to avoid eating, to avoid alcohol, and to avoid caffeine. So the plan here generally is later on in the evening, slow down a bit, get ready for bed, slow your body down, put yourself in a better position to rest and relax in that cycle of sleep. So another option is to prepare for sleep with low-level background sound. So these are available now in smartphones, of course, but a lot of people have come into me with said they just have a fan on in their bedroom all day long, even if it's in the background. And interesting that some people say that the fan or some music is on in their bedroom all the time during the day. So when they go into their bedroom at night, they're not doing something to remind themselves that they have tinnitus. That background noise in their bedroom is just part of their bedroom. So lots of different options here. And lots of different things people can use. In our tinnitus conference that we have every year, one person came and heard about the sound with tinnitus, and he interacted with his son, and they ended up putting a sound speaker in a pillow. And it turns out that it was very helpful, and the son went ahead and manufactured a sound pillow, developed a company making a sound pillow. So there's that's still available, and you can connect to it with an external source now as well. But there's things to do in the bedroom to have some background sound to make it a pleasant place. Maybe you can control it, but if your partner doesn't like the sound, you can have a sound pillow too. Lots of different options these days. It needs to be a pleasant sound, calm, soothing, steady, classical music. You don't want to listen to rock and roll at night. It can actually be a nature sound. So it can just be waves or rain sound, raindrops, or just a broadband noise, a shh sound. So different for different people, but you can choose a pleasant sound that you can enjoy and that you can ignore. So you're sleeping with a partner, you need to both agree that it's pleasant. The pillow loudspeaker I mentioned, so that only you hear the sound. And some people tell me that they go to bed first and that the sound can be turned off on the timer. And that's true with your smartphone, of course, as well. So lots of options to help people sleeping with their tinnitus. There are also some things you can do to help prepare for bedroom time and sleeping. And part of this has to do with progressive muscle relaxation, which I will talk about, and also visual imagery, two techniques that can be used. So progressive muscle relaxation. So this has to do with systematically tensing and relaxing muscles. So it's in an organized fashion and tensing muscles and relaxing muscles. And when you're doing that, you're focusing on your muscles. You're not focusing on your tinnitus. You're not focusing on your challenges that you've had at work that day. And this allows you to relax as well. So relaxing your muscles obviously can help us as we get ready for bed. So the example here, and you can all do this actually, you can all hold out your hands and make a fist and squeeze it hard. Squeeze it, squeeze it, squeeze it. Hold that fist. Now gently relax, relax, relax your fist. And your fist is relaxing and your arm is relaxing and you're very focused now. And you're focused on your arm and that muscles, and you're not focused on your tinnitus. So you're doing something that's distracting and focusing and good for you. Another example here is referred to as visual imagery. So I always like this one because I think of being in Jamaica and focusing on the waves and focusing on a palm tree behind me. So close my eyes. I think about those waves. Boy, that I can feel the sand below my body. I can hear those waves. I can feel the sand. I can smell the water. The sound is there. This is wonderful. So this is a way of using visual imagery, imagining things with your eyes closed. And when you're focused on these things, again, good for all of us. These are used not just for tinnitus patients, but used for people in distress in general. To use things like visual imagery can actually be quite helpful to calm down and to relax. So you're not thinking about your tinnitus all the time. You're giving yourself something to do as opposed to being overwhelmed by that tinnitus. So what things might be affecting your sleep? You've got this sound in your head, your tinnitus, but are there some things that you can do to change your activities before you go to bed to improve your sleep? This might be daytime or evening activities, things you can do to prepare for sleep using these relaxation techniques and using background sounds. So if this is a problem for you, then here's a sleep diary that you're going to go home and go home with and keep track of your sleep habits. When you went to sleep, when you wake up in the morning, what you tried beforehand, what you did that day that you think affected your sleep. So sleep is really a common problem for tinnitus patients, but it's also common for lots of people. So there are some things that you can do, and lots of people have been helped by using background noise in their bedroom, by having a schedule that they follow carefully, to put their body in a routine for getting to sleep, and things like the sleep diary and things to help as well. So we're all different, but sleep is common for people with tinnitus that have this sound when they go to bed. So you're not alone, but there are some things that you can do, and we can help you to make it easier to get to sleep. Okay, so they'll go home with some homework. They'll come back 2 weeks later. We go over their sleep homework, and then we move on to concentration. Again, these are assuming that these are the areas that are affected by the individual that we're working with. Everybody's different. So welcome back. We've gone over your sleep homework, and now we're going to focus on concentration. So we're going to talk about things that affect our concentration for all of us. And then we'll talk about how tinnitus can affect our concentration. Got this noise in the background, this whistle sound that's distracting us. And some strategies that you can do to improve your concentration. So we're going to do that today. So lots of things affect our concentration. So there's background noise coming out of the radio, something distracting going on, the temperature, some shining light in the background. Lots of things can affect our concentration. That's true for all of us. And when you've got this tinnitus sound going on, that could be a problem for you. So what problems do you have with your concentration? Have you tried anything yet? How has tinnitus affected your concentration, and how has that affected your life? So again, the first phase in all of these sessions is to listen to the patient, to be a good listener, to understand where they're at, to understand what problems they're having, and to connect with them directly. So this is an individual session, and I want to understand their individual needs, and I want the patient to understand that I care about them, and that I am focused on learning about how tinnitus has affected them as an individual. Okay. So for all of us, we perform best when we're focusing on one thing at a time. We're trying to do lots of different things at the same time, and it's less efficient for all of us. And if we're distracted by our tinnitus, of course, that's going to make it harder to concentrate on other things. That's going to be common. A common problem here for lots of people is they're distracted by their tinnitus. So some things that you can do to improve your concentration abilities. So these are the things in general. To interpret your tinnitus as not being that important. It's only a sound. It's not a good sound or a bad sound. It's just a sound in the background. Eliminate things that are distracting. Staying focused on the task. You might be able to adjust your work habit to make things easier to concentrate on. And decreasing the prominence of your tinnitus should make it easier to concentrate. So we can practice taking control of your attention, and we'll do that in this session. So first of all, we'll emphasize again that tinnitus is not that important. It's not threatening your health or your hearing ability. Tinnitus is a result of increased spontaneous activity on your nerve fibers, which we've gone over before. But if you believe your tinnitus is important, then you're going to monitor it. You're going to focus on it. But if you believe that your tinnitus is not that important, then you can begin not to attend to it. So you're in charge here a little bit of what you focus on. If it's just a sound in the background, it's not good or bad, you don't care about it, you're not going to focus on it. You won't be distracting concentration. So for all of us, it's helpful to be focused on something. And we all have different distractors going on in our lives. There might be some background music or something terrible happened to us this morning, or we're worried about an event this evening. Stay focused for all of us. So that means actively participating in the task. Be engaged. Sometimes take notes. Ask questions and get involved in the discussion. Repeat the information. So I think I heard you say A, B, and C. Be organized and categorize the important points. So stay focused in the interactions that you're working on for concentration. It's also going to be helpful, of course, if you can decrease the prominence of your tinnitus. And background sounds in the environment can be very helpful. So a lot of people with their tinnitus have a fan going on or have music going on from their computer or from their smartphone. So having a background sound is going to decrease the prominence of your tinnitus. It won't stand out like it does in quiet. And again, talk about sound therapy devices later on, but background sound is really helpful for a lot of people, whether it's a wearable device or something in their office or something in their kitchen, to make the tinnitus less prominent. And you can take control over your attention. Usually our attention is actually under your individual control. People don't always appreciate that, but you can control your attention specifically. And if you're focusing on your tinnitus, that's going to be distracting and distressing for you. And it may be that when you go home, you're in a quiet room, or when you're driving a car and it's quiet, or when you're sitting waiting for something and it's just you and your tinnitus, you're focused on your tinnitus. So what can you do to take control of your attention? Okay. So we can all practice this, learning to switch attention from one thing to the other. And that might be visual attention or sound attention. And by being distracted, by taking control of our attention, we can divert our attention from our tinnitus to something else in the background or something else more important. So the tinnitus is there as a sound in the background, but there are other sounds that can affect, and we can control how our brain is focused on different things. So as an example here, we're going to practice. I want you to focus on the pen that I have right here in my office. So I want you to just look at this pen. Just look at it. Now look at the book on the table. Now look out the window. Just focus on that. Now go back to the pen. Now go to the window. So focus your attention on these different things. You're in control of your attention. You can control this. Now let's use, yep.
Richard, just one moment. We actually have come just past our time.
Okay, sorry, I'm just about done here.
Okay.
Okay.
You have such great information. You really do.
I'll finish it up very quickly.
No worries.
Focus on your sound, so you can actually get people to listen to different sounds in the room. And one of the interesting things we do is, okay, pay attention to your tinnitus. Now pay attention to that radio in the background. Pay attention to your tinnitus. Pay attention to your tone. So the idea here is to give people in control of their own brain and their own attention, so they can focus back and forth on this. So that's the end. So we have a book, Tinnitus Treatment on Clinical Protocols, that goes over some of these. Tinnitus is common. It can affect thoughts and emotions, hearing, sleep, and concentration, different in different people. Our Tinnitus Activities Treatment, the slides I showed you, are available online. Hearing aids and sound therapy can clearly help. To finish, why is this person screaming? Well, I went to a coffee shop and somebody had painted watercolors on the coffee shop window to scream. And I don't know if you probably didn't see my tie here, but I have a scream tie as well. It turns out that the reason this person is screaming is because he's dropped his coffee cup. So now we know. There it is, the scream. We'll be having our 31st annual conference, August 8th and 9th in Iowa City. You're welcome to attend in person and Zoom. And here's the preliminary program. We have people present from all around the world, including different manufacturers. And again, this is available on our university website. And we always have a square dance in the round barn that I'm restoring as part of the Tinnitus Conference. Okay, sorry to go on so long. Is there time for a question or two?
If anyone has one, but we can also go ahead and relay via email if anyone does have any questions. We really, really appreciate your time, and that's great information. So thank you so much for being here. Next time, maybe we'll have you talk a little longer.
Okay, sorry about that. I apologize.
No, you're fine. Anyone have any questions to ask now? Or we can go ahead and take, you said all of those are available online?
Yes, yep.
Excellent. Excellent. Okay. Well, I think we'll just take about a 10-minute break. Thank you so much, Richard. We really appreciate it.
Thanks very much. Goodbye.
So I think just a quick 10-minute break. I am looking to arrange our next speaker. Let's see. Okay, so our next speaker is going to be Ted Venema, and actually I'm working with him to get him onto this as well.